And that's the last thing I wanted to talk about, is from projects to movements. We want change to sweep the countryside rather than make a difference in a single village. We need to stop, I hope I'm not stepping on toes. We need to stop wasting so much money going in and putting in wells for people, and begin to learn to work in an asset-based way that helps them to create solutions that can be multiplied from village to village, so that what we get is movements. And so I want to ask you, can you claim that your work has the potential to become a movement that sweeps the countryside? The first question is it catalyzed by champions, not by paid people, but by people with a passionate love for, I'm doing it again, people with a passionate love for Jesus Christ, who love their neighbors, and their motivation is their love for him and their love for neighbor, and not money. And these champions are nationals, always. If you want a national movement, it is led by nationals. We can be consultants to them behind the scenes, but it's their work. And if we want a movement, it has to be theirs from the beginning. Second, it has to be locally owned. Third, it needs to be asset-based, because if you're bringing in things from the outside, you're creating dependency on those things. If you want to multiply what you're doing, you have to bring that same stuff in every time you go somewhere. But if you're doing an asset-based approach, the solutions are created locally, and they can be reproduced and multiplied. We talk a lot about sustainability. That's not the question. The question is it multipliable? Anything can be sustained. What we want is something that can be multiplied. And integrated, spiritual and physical, across the sectors rather than within them. Agriculturalists need to be able to make disciples. And pastors need to be able to teach health promotion and disease prevention. It needs to be integrated and multiplying. If your work is those things, then you have the potential of creating a movement that will not only change a village, but sweep the countryside. As you can tell, I'm excited. I think that what we have in community health is an opportunity for the medical world to get out of the back seat and in the front seat in missions. And here's why. You can take the wheel and drive it, because the only people that are equipped to begin at the village at a level of deep need that lays a foundation for the total transformation of the village are community health people. Community health for me has become a framework for global mission in rural villages.